Welcome everybody. So this is the first in our series of our core webinar about our new research project that we collectively are working on, that we would like to share with you some of the details of our plans. So welcome, and we've got a diverse audience with us today, which is great. And the webinar will last for 1 hour, and we've left 15 minutes at the end for any questions and discussion. So please do ask questions, either by asking them in the chat function or asking at the end in person when we will open up the discussion to the audience. What we're going to do today is an overview of our new research program, and in subsequent webinars, we will go into more detail and depth on different components of what we're working on. So this is really the first part of our story. And the objectives of this, the objectives of this first webinar is really to provide the background policy context for our research program, and then to give an overview on our different elements of our program in terms of its aims, the work packages, and a very important part of our work is the community engagement and involvement elements. And we will also be describing our training and capacity building part of the program. So in terms of the background to what we're doing, many in the audience, I think, will be familiar with this, but not everyone. So in relation to oral health, the last few years have been a dramatic period of policy change, particularly led by the WHO in Geneva. So in 2021, there was the WHO resolution on oral health, and then the Global Strategy and Action Plan has been published, and as part of that Global Action Plan has highlighted the importance of research at a global level, including low and middle income countries, and the need to develop research capacity in oral health research. So some of those drivers have been very important influences on our work. The Bangkok Declaration was published in December of last year following the Bangkok meeting, which WHO led, and that was the first global meeting on oral health. And again, research was repeatedly highlighted as an important area for development. Very recently, we have had the updated version of the Global Burden of Disease results. And that study, published in the Lancet literally a few weeks ago, highlighted at a global level 3.7 billion people around the world are affected by oral diseases. Most worryingly of all is the fact that amongst low and middle income countries, the proportion of the population affected by oral diseases is increasing. So the burden around the world is increasing and not decreasing. So the issue of inequalities within countries and between countries, again, is an enormous area of concern. And finally, as background to our work, the Lancet Commission on Oral Health has been working for the last 5 years and is due to publish this year, and several members of the Lancet Commission are also involved in this research program, and the work is in parallel with the recommendations that will be emerging from the Lancet Commission in the forthcoming period. So that's the background to our work. What I want to do now is pass over to my co-lead, Carol, in Colombia, who will give you more details of our program. So over to you, Carol.
Thank you, Richard. So hello, everyone. Lovely to see you all here. Good morning, afternoon, or evening, depending where you are. So thank you, Richard, for presenting this background on global oral health. And now let's look at the program itself. So first, as you can see here, CORE stands for Community-Focused Oral Health Research for Equity. And it is a program funded by the UK National Institute for Health and Care Research, NIHR, and it is a cross-country collaboration between Brazil, Colombia, India, Kenya, and the UK. So the program aims to establish an equitable and effective research partnership, also to assess the pattern mechanisms and impact of oral health inequalities, to determine the influence of commercial determinants on oral health, to assess the economic burden of oral diseases and opportunities to improve access to quality dental care services, so oral health system reforms, and finally to co-produce, co-design, and test different public health interventions and to reduce, to tackle inequalities and promote oral health. Now, in terms of our values, we think that innovative community-focused approaches are needed to challenge the status quo and the dominant Western narratives and approaches. We also think that it is essential to ensure that principles of diversity and inclusion are embedded in all aspects of our program. Similarly, all programs components are based upon respect, transparency, and build trust between stakeholders, communities, and all institutions and collaborators. Another value is fairness for us, so to make an equitable collaboration in the program. We also are guided by this idea of mutual learning, learning from each other, something that we are doing from our communities and collaborators, and finally, capacity building and strengthening. Now let me introduce the core program management group. So in the UK at UCL in London, Richard Watt, our PI, Chantel Diane, our program manager, Louis Gregory, our research coordinator, Mitchell Stennett, our researcher at the program. Also in the UK in London at Queen Mary University, our dear Manu Mathur. In Glasgow, University of Glasgow, David Conway, and at University of Staffordshire, Al Ross. Now in the partner countries, in Colombia here, Carol, based in Bogota, working at National University of Colombia, and I'm working with a lovely team of people. Each of us are. In Recife, University of Pernambuco, we have Paulo Goes and his team. In India, before Kenya, University of Nairobi, our dear Regina Mutabi and her team. In India, we have Abhishek Mehta, Manu Mathur in New Delhi, and in Ahmedabad, our dear Mirai Chatterjee, also on the screen, you can see their faces. They have the cameras on. And in each of the countries, we have lovely teams of people working with us, making this possible. Also, our program has a great group of international collaborators. You can see them here from different countries, US, Ireland, Australia, and Singapore. And let me also acknowledge our amazing external international advisory group. They have provided very helpful feedback and advice. This is a very diverse group with people from all partner countries with different backgrounds and interests. So this is great. And let me also share with you that last October, we visited New Delhi and Ahmedabad in India. We had an exciting program of activities, including a launch event in New Delhi. That's the photo on the left side of the slide. So we had a very lovely time during the launch with, representatives from the academic institutions, policymakers, community groups, social organizations. It was a great time. And also we had the opportunity to visit the Navapura village close to Ahmedabad. That's the photo on the right side, where we had the opportunity to have a very enriching conversation with community members there. Now, let's move on to our research packages. We'll have the chance to hear more details about each of them, so I will only mention what they are about at this time. So the first work package is about oral health inequalities. The second one is focused on commercial determinants on oral health. And number 3 is focused on access to quality dental care, so systems reform and innovation. So I will now refer specifically to the first work package, focus on oral health inequalities, and I will present this work package on behalf of Paulo Goes and myself. So let me focus on the first three studies because the last one is a feasibility studies on intervention on inequalities, but we'll talk about that one in the specific webinar on inequalities. So the first study is about mapping patterns of oral health inequalities around the world using nationally representative data sources, surveys. For this work, we are working with our collaborators in Pelotas, in the International Center for Equity in Health in Pelotas, Aloysio Barros and Francini Costa. And they have done this amazing work with so far 44 countries data, nationally representative, and they have done great analysis for different oral health outcomes by different dimensions of inequalities. And so far, we have country profiles like the one you can see here on the left side from Brazil, mapping the inequalities in terms of geographical inequalities, wealth inequalities, and so forth, and also producing some equiplots, thank you, Richard, on the right side, like this one, comparing across countries. The second study in this work package is a qualitative study. It's called the Unheard Voices on Oral Health. It's an exploratory qualitative study. We engaged with disadvantaged and vulnerable groups across different countries to explore their views and experiences on oral health and oral health services. And we use, as I said before, an exploratory qualitative research approach to capture their stories, amplify their voices and opinions, and we are now analyzing this data. Study number 3 in this work package, one is about using simulation modeling to assess different interventions, right? Policy interventions and their potential, not only to improve like population oral health on average, but importantly for our project, how those different interventions could tackle inequalities. For this study, we are working with our collaborators in Australia, specifically Ankur Singh and his colleagues, previously at the University of Melbourne. Now he is based at the University of Sydney, but some of his colleagues who are still based at the University of Melbourne are working on this. And also Marco Perez, based at the National Dental Research Institute in Singapore. So for this analysis, the idea is to compare different scenarios, right? Different policy scenarios, as you can see on the bottom. So for example, business as usual, attacks only on beverages, sugar-sweetened beverages, attacks on both foods and drinks, and for example, motivational interviewing. On the left side, you can see some of the initial analyses that have been done on this, and we are now moving forward to conduct analysis with our partner countries. So this is work package 1. Would you like to add something about this, Paulo? Please do. Over to you.
Just to say that we have some news from Brazil. We just have the publication of our National Oral Health Survey and came up a group of papers on inequalities in oral health made by our friends from the Federal University of Minas Gerais that definitely you have take to us great insights about inequalities and oral health.
Thank you, Paulo. That's great. So now let's move on to work package 2, focus on commercial determinants on oral health. So over to you, Richard, for this one. Thank you.
Thank you, Carol. So myself and Regina in Kenya are leading the work package on commercial determinants of health. And hopefully most of you are familiar with this term, but commercial determinants of health is really exploring the influence of commercial organizations, either positively or negatively on health. And in our case, what we're particularly interested in is the influence of the global sugar industry on oral health policy, on oral health decision making, etc. So this is an exciting part of our program of work, and what it's really shining a light on is the power and influence of the sugar industry globally. And just as a slight an aside, but as an illustration of this, last week, President Donald Trump was in Saudi Arabia, and at their business lunch, he brought together leading industry figures from the US. And amongst those 20 people was the chief executive of Coca-Cola Company. So that shows you that how influential and powerful Coca-Cola is by being at that table when they're discussing trillion-dollar business transactions. In our program of research, what we are doing is 3 studies on the commercial determinants of oral health in our 4 partner countries. And the first study, which has been completed in Colombia and in Brazil and is near completion in Kenya and India, is looking at the evidence of what we call corporate political influence on oral health policy, research, etc. So using a template that's been developed by other people working in this field, we've documented evidence of sugar industry tactics across our partner countries to shine a light on the degree to which they are influencing policy. Our subsequent 2 qualitative studies, which are planned for later this year, next year, will be interviewing stakeholders to explore in more detail from a qualitative perspective the evidence of industry influence on research, policy, and action, and also, very importantly, identifying mitigating strategies that might be able to be implemented to reduce industry influence. So in a future webinar, we will go into more details on this and provide more insights into our planned results and planned future studies. But let me move on to the next work package, and I'm going to ask my colleague Abhishek Mehta from Delhi to give an overview of work package 3, an initial study that has been conducted in India. So over to you, Abhishek, please.
Thank you, Professor Watt. So as told, that work package 3 is health system reforms and innovation. There are different studies in that. The study 3.1 is assessing the economic burden of oral diseases. The study mainly aims to evaluate the economic burden of oral disease in all the LMIC. And since I'll be talking a little bit about India, that we are going to check the pattern of oral healthcare service utilization, whether in terms of rural, urban, gender-wise, or any other available criteria. We also will be checking the out-of-pocket expenditure for dental conditions, as there are certain issues with the health systems in low and middle income country, and the incidence of the catastrophic health expenditure which result from oral health care. So these 3 are the aims of the first study under this work package. Next slide. So in India, we are going to do a secondary data analysis of the nationally representative surveys. So it will be similarly in other countries also similar surveys, if available, will be used to achieve these objectives. In India, we are using the 2 main surveys which have been done nationwide. The first one is called as LASI, the Longitudinal Aging Study in India. It is done on adults age 45 years and above. And in the last wave, the more than 72,000 adults were examined. And the second survey which have been done is by National Sample Survey Office, which again deals with various health issues and the social and economic issues which our country and our population faces. The final analytical sample included 34,000 individuals, which specifically told about oral health from LASI, and for around 440 individuals reporting oral condition from the NSS rounds which have been conducted. All the data are being analyzed using the Stata software, and with the appropriate survey weights were applied in that. Next slide. So the progress so far is that the data has been analyzed, whatever the data was available with respect to oral conditions, and a weighted estimate of service utilization, out of pocket expenditure, and catastrophic health expenditure has been done. The key findings are being collated and are being interpreted across different social demographic groups, and will be soon disseminating the findings in form of a scientific publication in a peer-reviewed journal. Thank you, Professor Watt. I'll be handing over to you now.
Thank you, Abhishek. So that's an overview of our 3 work packages. And as you've heard, they complement each other on topics around inequalities, commercial determinants, and system reforms. And overall, the direction there of travel is ultimately to co-produce interventions to address inequalities in oral health and improve access of disadvantaged and marginalized communities to oral health services in our partner countries. Now, a very, very important part of our overall program is the community engagement element of our work. And we are really privileged to be working with Meera Chatterjee in India from the Self-Employed Women's Association, who has been guiding us in the development and implementation of community engagement involvement in our research process. So many of us who come from an oral health background know that we in oral health have been very bad at involving and sharing decision-making with our communities and people with lived experience of our diseases. And in our program, we aim to change that by developing and testing innovative methods of engaging with the local communities, particularly the local disadvantaged communities in our partner countries. So what we are doing in India, Colombia, Brazil, and in Kenya is, firstly, we have completed what's called a community mapping exercise, where our teams on the ground mapped out, met with, discussed key issues with their local communities to understand in more depth the nature of the communities, the dynamics, the power structures, the levels of trust, etc., with the local communities we're working in. And very importantly, that work was targeted amongst communities that have been underserved by dental services in those countries. So a lot of work was taken to develop the trust, make the links, and now that's beginning to move forward. So in each country, what we have got is we're appointing and running what's called community forums, where members of the community will come together to act as an advisory group on all aspects of our research. We are also engaging with community link workers who will be trained and assist us in collecting data from our communities, helping us understand the priorities and initiatives from our communities. So these community link workers will be fundamental. And then in a later stage of our work, we will be co-designing and co-producing interventions and methodologies that will share the decision-making on how we develop the interventions and test them with our communities that we're working with. So this, for me, is one of the most exciting elements of our work. And in a future webinar, we will go into more detail and depth and show you some of the methods and results that we've got from this community engagement work. What I want to now do is move on to the training capacity building component of our program. And I'm going to ask our colleague Manu to now speak on the training and capacity building part of our program. Over to you, Manu.
Well, many thanks, Professor Watt. Hello, everyone, and thank you for taking out time to hear about our project, Project Core. A very important component of the project, which we are doing in the 4 countries, is training and capacity building. And when we talk about training and capacity building, we are not only following the standard ways of just imparting some training programs, some short courses, but the focus is to go top down as well as bottoms up. Learning from the community, learning from each other, and rather than being a one-way traffic where we just impart certain things to the young researchers, we also learn between the countries. So there are ample learning opportunities, which are there between different countries. To start the training and capacity building activities, we initially undertook a training needs assessment exercise. A mix of qualitative and quantitative methods were used to understand where the current capacity of young oral health researcher lies in all the 4 countries, which are the areas where we can intervene the most, and which are the areas where we can really make a difference and we can really empower or strengthen the capacity. So we have got the results of the training needs assessment from all our 4 countries. And based on those training needs assessment exercise, we have created a training and capacity action plan. So every country has developed a training calendar. And what this training calendar essentially entails is that there will be 2 face-to-face short-term training programs which will be organized, which can be up to a week long in duration. There will be a number of online webinars, a number of online workshops we will be organizing in different languages, so that on different aspects of oral health research. So one of the major gaps we found out was qualitative research. The other gap we found out was, just talking about fundamentals of research methods. And we have been organizing these now in Colombia, India, Kenya, and Brazil. We have the other important thing which we are doing under the training and capacity building is creating the next cohort of public health, dental public health leaders. And this is where we have provided 4 MSc studentships, 2 in University of Glasgow and 2 at University College London. So 1 scholar has been selected from each of the partner countries. And they have been provided enrollment in one of the 2 universities, and provided a full scholarship to undertake their MSc in dental public health at both these universities. We are very happy to tell you that through a very fair process and through a very competitive process, we have selected all these 4 students from the 4 countries, and they will soon be starting their MSc program. I was talking about the training programs which we have. So 2 face-to-face, up to 1 week of duration training programs will be organized in each country, along with a number of webinars on areas which we found as the gap or the need in all the 4 countries. And in addition to these learning or training opportunities, we have also started an online research mentoring program, which will be run in each country. Basically, this is a program where we will be matching researchers, young enthusiastic researchers from the 4 countries to a mentor. And this mentor can be in the United Kingdom, or they can be in any of the partner countries, or countries where we have our extended partnerships. And these people will be providing them career guidance on how they can move forward in academia and things like that. So this is another thing which we've started. And as Professor Watt pointed out, that community engagement and involvement is a very essential component. So we have got a series of community training events which we will organize so that we can disseminate the findings of our research. We can introduce our research on oral health and link it to our community engagement and involvement activities. In the process, learning from the communities and, developing our core design plan, as Professor Watt mentioned. So this is in a nutshell about our training and capacity building program.
Perfect. Thank you, Manu. And what we're going to end an overview on is on our monitoring, evaluation, and learning plan. And again, Manu and David are the leads on that. But Manu, over to you to give a brief overview of our monitoring systems.
Thank you, Professor Watt. So, along with Professor David Conway from University of Glasgow, we have developed a very robust monitoring, evaluation, and learning plan for our project. We started with a theory of change model, which we use to inform the design, conduct, and process of working across multiple partner organizations, building our research strategy, and developing very clear outputs and outcomes and the impact which we envisage from different work packages. So I will not go into detail of this busy slide, but this was the genesis, or this was the start of our theory of change exercise, which guided what kind of impact we are looking for from our project. Based on this theory of change model, we then developed logic models for different work packages for different work stream. So clearly defining what the inputs are for every work packages, what are the activities we need to conduct, what can be the short-term, mid-term, and long-term output or impact which we are expecting from each of the work packages and each of the activities which we are doing. So we have gone into detail to develop these logic models. Based on these logic models, we developed an indicator framework or a monitoring and evaluation framework, which we are using to check the progress we are making with the project, whether we are able to achieve our milestones. If we are not able to achieve our milestones, what are the drawbacks, or what are the possible barriers which we are facing, and how can we take corrective action? So we are in the stage of finalizing the data collection tool for our monitoring and evaluation indicators. Once we have finalized the tools, we will be using our periodic reports to collect data and analyze the data. And it's our endeavor that we will be disseminating and reporting on the progress we are making at different work packages through the plan. So over to you, Professor Watt.
Thank you, Manu, for that overview of the training issues and of our monitoring and evaluation. And as Manu said, a really fundamental part of our work is the south-to-south learning, the expertise that is shared across our partner countries. And just one example to illustrate this, in Colombia, we've got some very experienced qualitative researchers that have been running some training courses to help others develop the skills around qualitative methods. So that south-to-south capacity building is equally, if not more strong than the north-to-south exchange of ideas and skills. But let's now move back to Carol, who's going to tell us a little bit about our sort of communication and dissemination steps so far. So over to you, Carol.
Thank you, Richard. Just before we move on to the discussion part of the session, we would like to share that we are going to present some of the work that we have been doing so far at the next IADR general session that will be next month, about 1 month from now, in Barcelona, in Spain. So please, if you want to know more about the core project and the specific studies, please join us at the different presentations we are having at IADR. And also in terms of communications, we have different channels. So please find out more about our program at the website. Keep in touch by email, LinkedIn. Well, we are also have our channel in YouTube where these webinars will be placed as well. And we also use by Skype now, so you can get in touch with us there as well. And also, please join us for the next webinars. So we have already scheduled our next webinars. You can see the dates and times here. All of them will be at 2 p.m. UK time. So we are going to explore more in depth each of the work packages and components. So we have one on inequalities, commercial determinants, oral health system research, and community engagement and involvement. So please keep those in your diaries if you can. It will be lovely to have you all and your colleagues in these sessions. We also would like to acknowledge our funding body, NIHR. So this research, all the program, as I mentioned at the beginning, is funded by the UK National Institute for Health and Care Research. This is the grant number, and we would like to acknowledge our funding body as well. So I think now we can move on to the discussion part of the session. So over to you, Richard. Thank you.
Thank you, Carol. So yes, so we've given an overview of our program and it's now an opportunity for some questions. So what I think I'll do is stop sharing the slides and then we can see everybody again. So yes, we've given lots of ideas on what we're working on. So it's your chance to ask us any questions about what we've described, anything that's not clear, anything you'd like more information on. We would be delighted to either answer you in the chat room or through discussion. So is anyone going to ask us a question?
Maybe
Don't be
just
shy.
mention, Richard, that if you feel more comfortable, you can put your questions in Spanish or Portuguese and we can translate them as well. If that's an option, you can do that.
Good point. Oh, so here's a question. Oh,
Yeah, my name is Xiang. I work in Dundee University, Dental Public Health. So I have a very simple question. Can you elaborate a little bit more in the training of using simulation for intervention effectiveness? It's just one element from one of the slides that Professor Manu showed.
yeah, well, I think the modeling might have been the slide that Carol showed about the
Oh, okay. Sorry.
qualities work that Anchor Singh is doing. But Carol, do you want to say a little bit about that? Because that is a complex methodology and Anchor is an expert in this. But Carol, do you want to say a little bit about capacity building in that space?
Yeah, sure. That's an exciting part of our project and work package one. So we aim to learn from Anchor and his team about this technique. Simulation modeling have been used, if I'm not wrong, originally in the economics area and field, and then we adopt those techniques and methodology for health. So we are now using this simulation modeling techniques to kind of simulate different policy scenarios and their impact on population oral health and inequalities. So what, in general terms, what I understand, but as I said before, we're aiming to learn from Anchor more about this, you feed the model with information about demographics, morbidity, mortality patterns in each country. You then set certain parameters for the model in terms of age, gender distribution, and so on. And also you feed the model with the input you can get from the literature about how those different interventions behave and the results they might have. And then the magic happens with the model, and then it shows you how different interventions can have different outcomes in 10, 20, 30 years. And that's actually a key tool, for example, to talk to policymakers. You can show them, look, if you implement this sugar tax, for example, in 20 years, you can be saving this amount of this many lives. You can be saving this amount of money in terms of healthcare. You can use for promotion, for other expenditures, and so on. So yeah, I hope I replied to the question. That's the general idea. And as I said before, this will be a component that we will explore further in the training and capacity building as we aim in each of the partner countries to learn in detail how to do this modeling. Thank you.
So it's a very good question. And I think as a also general response is, I sort of speak on behalf of all of us, I think all of us involved in this program are learning from each other about new things that we didn't know about. And the thing I'm most excited that I'm learning about is about community engagement and involvement and how to translate that into reality with our communities. So over many, many years, we've talked about these issues. But what we haven't done is actually implement them and try them out and test them out with real people, particularly from marginalized and disadvantaged communities. So that to me is something, again, that we're learning a lot. So some of the skills are technical, analytical skills, but a lot of the work is also about implementation and working with our communities. Now, we can see we've got a message from Sybil that's mentioned about sharing the results of the mapping of the inequalities. Well, that data will be presented as part of the Lancet Commission in Oral Health that will be coming out later this year. But there will be other papers and presentations on that important work. Carol, do you want to say a little bit more about when the results will be available and reported?
Sure. Yeah, thank you, Richard. As you said before, a lot of these results will be published as part of the Lancet Commission on Oral Health report. We are also presenting some of those results at the next IADR. So will be a couple of abstracts on this, like showing some results of the mapping on oral health inequalities, and other papers will come, I think, hopefully this year and the next, out of that analysis. As more countries are added to this analysis, to this study, we will produce more results. It's exciting, and thank you for your interest. And please keep an eye on the Lancet Commission report, presentations at IADR, and papers that will come out with results from that analysis. Thank you.
Good. Now we've got a hand up from Emily. So over to you, Emily, to ask your question.
Hello.
Hello, Emily.
Hello. My name is Emily. I'm from Brazil. So thank you for the presentation, and it's long and hard working, and it's so beautiful project. And I'm working on a volunteer project in a place where don't have clean water. So it's harder to brush their teeth and having the personal hygiene. And do you think low cost water filters, for example, could improve and could help these communities to do this personal hygiene? And that's it.
Yeah, well, that's a very important question, Emily. And I think it also highlights really about the infrastructure and the environment in which people are living in and its effects on limiting people's choices, whether that's about their diet or their hygiene. But I am not familiar with water filters. And sorry to put Paulo Góes on the line, but I wonder, Paulo, are you familiar with the option of using water filters in Brazil?
Yes, I don't know the region where the Emily comes from, but here in northeast of Brazil, it's very common in the rural areas where the health authorities give this kind of dispositive to communities, remote communities, in order to clean water with other substance like hypochlorite to clean water when they do not have a clean and treated water for communities. In the northeast of Brazil, in the north, are very common dispositive to clean water. It's very cheap. It's very cheap.
Good. Thank you. Thank you, Paulo, for answering that. Now, I can see a comment from Zamros, but just before I say that, I just noticed on our call that we've got several people from the UK as well, which is great. So welcome to all of you. And I suppose the message to those of us working in the countries like the UK and other high income countries is our work also has resonance and relevance for all of us because of the nature of what we're doing around inequalities, commercial determinants. So although our data will be coming from middle income countries, hopefully it will also be of value and influence within other high income countries as well as middle and low income countries. But I'm glad to see that Zamros is on the line, and he's asked from Malaysia, and that they are already doing research on oral health inequalities and developing interventions. So it'll be incredibly important, Zamros, to understand what you are doing and to share and communicate, because we don't want to reinvent things. So it would be interesting to hear what you are doing in Malaysia. And one of our interesting issues is by co-producing with our partner communities, we might have different products in each country that we're working in, because each of the communities themselves may drive different solutions. So, as I say, it'd be interesting to understand what's happening in Malaysia, where there's lots of interesting research and policy development taking place.
Yeah, if I might, Richard, just to mention, following Sibel's questions, that we will include links to all our papers, abstracts, and other dissemination forms in our website. So if you keep on visiting our website, you will find there the links to our publications, events, and so on. So just wanted to mention that. Thank you.
Good. So any other questions at this initial stage of our program?
Richard, can I just make a point?
Please do, please do.
Like Emily, I think that she can get our address and contact in the core program page and be in touch with us in the countries. I mean, I'm referred to those in Brazil, and because we are very excited to let them know about the training course discussions we are having here in our local site. That's, all of the Brazilians are very welcome.
Good point, Paolo. And also in each country, as Manu's mentioned, there is training courses, both webinars and face-to-face training. So people in each of the countries should be in touch with the country leads to learn more about what's happening at the local level. So if there's not any other questions, thank you all very much for coming along. And you know, we'll keep you informed of developments as we move forward. We've got these new dates for the webinars where we'll go into more detail around some of the core topics in due course. And one thing I should have mentioned at the beginning, which I didn't mention, is that please do complete the evaluation form that you'll be sent in relation to this webinar. And if you complete that form, you can also get a CPD certificate for your time. So for some of us in some countries, that's important for our registration. So I'll be completing a form, I think, because I need to get my CPD times up as much as possible. But look, thank you all very much indeed for joining us today. And do keep in touch with us. We've got all these different communication channels that are open, and this project really is a global project, and we want to share and understand and work together with others across the globe, particularly in low and middle income countries. So, Carol, have I forgotten anything important to say?
No. I think that's fine, Richard. Just we had a couple of additional questions in the chat box. So maybe, as you said before, I think many of the learning points from the core program could be, I don't know if exactly transfer, but definitely learning opportunities for other countries, including high income countries. And this is a process where we are all learning, especially, I would say, from our communities. At least I think is the experience of all of us. We are learning from our communities. So I guess we will learn not only to understand better oral health, population oral health and inequalities, but importantly, we are learning how to work closely with our communities and how to break those power imbalances that we have for many years and don't help really to progress population oral health globally. So this is a great opportunity also to kind of learn from each other, from our communities, keep this network people learning alive and sharing experiences to move forward.
Very good point, Karen. Thank you. I missed those questions. So that's important. And just also to that, is the one thing we haven't mentioned is the engagement with policymakers, because unfortunately, often researchers don't speak to policy people. So one thing that we're also going to be doing is engaging with policymakers at a national level to link together what we're learning so that that informs future policy decisions. And then link to a point in the chat about sustainability, because that's fundamentally important as well. So thank you again for coming along. Do complete the evaluation form, give us your feedback, and we hope to see you again for the next webinar next month, which will be looking at the topic of health inequalities in greater detail. So lovely to see you all, and have a lovely morning, afternoon, or evening, depending where you are. Thank
Thank you,
you.
everyone. Bye.